12 million people in the UK are not having their recommended sight tests every 2 years.
1 in 5 people live with sight loss in their lifetime.
Nearly half of all cases of sight loss are preventable.
I originally noticed there was something wrong with my eyes because people questioned my driving. I went for the appointment at Specsavers. It wasn't until the eye examination, when they actually cover your eye, that I realised I couldn't actually see people's facial features. The optician explained to me that I'd got a cataract.
I basically went for an eye test as part of my regular checkup. I went to my local opticians, Specsavers, and I could tell something wasn't right. I was referred up to the Royal Victoria Hospital, and it was diagnosed straight away that I had glaucoma.
It was about 2 years ago that I noticed that my left eye, right at the side, it was a bit blurry. So I decided I would go to the opticians. She looked at it and said, "You need to go to the hospital tomorrow." After the MRI scan, a young doctor came in to speak to me. He said, "Do you know what you've got?" And I said, "No." And he said, "You've got a huge brain tumour and it's really serious. Do you realise this?" And I said, "No, I don't feel ill."
My name is Pierce Keane. I'm a consultant ophthalmologist at Moorfields Eye Hospital, and I'm a researcher at the Institute of Ophthalmology at University College London. I think it's absolutely vital to have regular sight tests. The absolutely crucial reason is that half of all sight loss can be prevented if we pick up the cause for it early and treat it early. People can face really an array of problems if they don't have regular sight tests, such as glaucoma, which is often something that people are not aware that they have and is irreversible if it gets too advanced without treatment, or conditions such as diabetic eye disease or age-related macular degeneration. And all the evidence shows that earlier detection, earlier diagnosis, earlier treatment lets us save sight. If you have a problem with your eyes, one of the first people that you'll go to is your high street optometrist to be examined. The advances in the technologies that we have, particularly the ocular imaging technologies, means that a lot of the diagnosis of problems with eye health can now be made in the communities by optometrists. Examining the eyes actually allows you to pick up things that are of interest for the rest of the body. So for example, examining the retina would allow you to see changes consistent with hypertension, which means high blood pressure within the body. And so if that's picked up, then that might allow you to attend your GP and have a blood pressure test, get treated for that, and then reduce the risk of having a stroke or a heart attack at some point in the future.
Having my eyesight back is absolutely pivotal to the rest of my life. I couldn't continue life as I like to lead it without my eyesight.
I just can't thank Paula and Specsavers enough for referring me, basically. If it hadn't been for her, then I could have been blind within 5 years.
I tell you, if it wasn't for Rabina, if she hadn't have told me to go to the hospital the next day, I'd be dead. So I can't thank her enough. She doesn't realise how much I think of her. She doesn't.
I found cataracts in my patients' eyes, which helped restore their vision.
I spotted glaucoma in my patient and stopped him having significant visual loss.
I discovered a brain tumour during a regular sight test, which saved my patient's life.
Specsavers' mission, together with RNIB, is to transform the nation's eye health through education, awareness and action. We want everyone, like the brave people you have just heard from, to understand the importance of regular eye tests to help bring an end to avoidable sight loss.